Hello, guys. Good day. This is Anna of Reinforcement Club. Today, we are just going to talk about the life of a Filipino nurse, expectations versus reality. Look, I'm telling you now, this is not the worst conversation that we're gonna have right now. I'm, I promise you, it's not the usual thing, the sad thing that you ever hear today. I'm sorry about that. So, way back when I was in college, when I took up this course, nursing in the Philippines, my thought actually, this is honest to goodness answer. I just want to party in Club 54, New York City. I don't even know what it is. I just want to hang out with people and go to the club and rock and roll. That's the only thing I got in my mind. I don't even know what's New York City. I just see it. I saw it in the in TV, and it looks nice. Yeah, I want to go to America. That's the thing. That's my only thought why I took up nursing, other than the fact that I don't know what I really want to do with my life. And yeah, this is the thing. Since I don't know what I want to do with my life, with my precious life, my dad decided for me. So, lesson number one, if you don't know what you're going to do, somebody else will decide for you. We'll give you something to do. So that was the thing that happened to me way back. Could be almost 2 decades now. Yeah, 2 decades. So that's the only thing that's in my mind, other than the fact that I have to study hard and pass the subjects, and then work afterwards. And way back then, when we graduated, that was long time ago, like 2008. There was like a surplus population of nurses that time, and it was a global crisis. I didn't understand what's going on, and I actually had some kind of thought about what really nursing was, because I have no job. I can't get a job way back that time. And since there was no job vacancy, I ended up being a volunteer for almost a year for two public hospital province, and the other one was kind of in the remote area. I also volunteered in the health center. So that was the learning process that I got. After all the efforts that I did, I work without pay, which I didn't understand way back then, because nurse when you go to college in Philippines, it's not going to be that cheap. You got to invest time, because Filipinos really work hard on education, so you gotta get your act together and save money. And going to college in the Philippines, just like everywhere else, and even in other countries, it's expensive. So you gotta make most of it, and do your best, because I'm faithful to my family. I don't want to let them down, and I don't even though I don't really know what I want to do with life. So let's go back to nursing. Then I met my friends. Some of my friends, those fellas, lads, way back then, they don't really know some of them, why they took up nursing. And I said to myself, I think I'm way better than them. At least I know I want to party somewhere in New York City when I graduate, and, I get to have a chance to go to America. But, rather than these people, they don't even know why they're here. Why are we even here and study this anatomy of the body and different parts of the organs and whatever, all those stuff. Some of my classmates, a big portion, they actually want to go abroad. Gosh. We haven't got any idea what's the job all about. The job description, the dirty stuff, the stress and all that. We haven't thought about that. We are actually focused on the big thing. The big thing to go abroad. some of the fellas that I hang out with, they don't even know where to go other than US and Middle East, which is, Middle East is the easiest and always been ever available to work. They're always open for healthcare workers in the Middle East. So if you want to start out your life experience with great people and use high tech equipment, so you can go to Middle East and rock and roll, meet good cases, rare cases, and manage them well because you have all complete facilities there. Now let's go back to nursing again. So the expectations commonly is really going abroad. And yeah, Middle East is the easiest one, while Australia, UK, uh, anywhere in Europe, New Zealand, you need to take up IELTS and OET for that, and you have to pass, you have to study. So it's a never ending study. Abroad, yes, it will happen. If you expect yourself to go abroad, it's not impossible as a nurse. One tick in the checkbox. Another thing is when you become a nurse, way back then. So me, I want to help my dad as much as I want to help myself financially. So that's why I took up nursing. I was thinking like, yeah, maybe this will help. Yes, it did, but initially, from the time that I graduated in the course, even after I passed the board, it was nursing wasn't that helpful. We have to go through that dirty stuff, those uh, kind of tasks that really hits you. The workloads, the low salary, but it was fun though. Working in the Philippines has ever been fun because you have the milk tea, your favorite foods are there after work. And McDonald's, Filipino style McDonald's. So if you want to help your family financially, as a reason why you want to take up nursing, yes, it's going to happen. But please remember that when you go abroad to help your family, you might just forget about yourself and you end up still striving and working even up to the age of over 65. So please never forget yourself financially, even if you want to help your family. So make it a priority to help your family and yourself. Not this option like to help myself or my family. Look, think in abundance. Help yourself and your family. So that's the thing. Number three, way back then, I haven't thought about traveling around the world. But the thing about nursing, when you already gone out of the country gone out from Philippines to work abroad, anywhere else in the world, yeah, you get to have a chance to save money in order for you to travel. It depends on which place you want to venture, or you just want to, travel around Philippines. Yes, when you're a nurse, you can do that. Unless, if you're when you're a nurse and you already have a couple of children, and you really have to weigh things out before traveling the world. You could still travel the world as a nurse, but you have to go through certain priorities. You have to finish them, and then you could go to that, looking after yourself now, and then go through that travel around the world thing, which is possible as a nurse. Another thing, yeah, I thought about this personally. Even my classmates way back, like when I was 17, 18, they want to migrate in US. Basically, that's how, the nursing education has been selling. It's all about US, but, there are other places available which are also good and healthy, mental health wise. So you have a couple of options. So migrate to other countries for greener pastures, because our own pastures are, I don't know if we were able to take care of that economically. you know just doing our profession in the Philippines is never been easy financially. If what we can get abroad, we have it in Philippines. We're not going to have thoughts going to abroad if we have the great deal of benefits in the Philippines. So that's the thing. Yes, when you are in abroad, you can actually have, yeah, the greener pastures that you're thinking about when you were a s- still a student nurse. Yeah, they have good opportunities here in education, and it is indeed true that talents are equally distributed globally around the world. But remember, opportunities are are not. There are just certain parts in the world wherein you can uh, find a great deal of opportunities, especially when you're in US. So if you want to be an actor, an actress, or a singer, or whatever you want to do, you have the chance to shine there. But you got to work your as off. You got to do the thing that they do. So yeah, that's indeed, yeah, you can migrate, which is possible as a nurse. Another thing, another expectation of a Filipino nurse is high income. Actually, speaking about this, yes, high income when you compare the currency differences. Peso is different from euro or pounds or dollar, US dollar. Yes, it is indeed high income when you compare the differences of the currency because we have our Philippine currency is quite a smaller compared to other currencies in the Western nations. So yeah, you thought about it as a high income, yes, but remember the cost is of living in a certain country actually is almost equal to the net income that you have. So you're still going to be struggling if you want to provide for your family in the Philippines. Unless if you are really super thrift, which there's nothing wrong if you are frugal. There's nothing wrong about it. You have, life is personal, life is an inside job, so you got your own freedom, you get to live what you want, so just do it. Do what makes you happy. Another reason why we take up nursing, I also thought about this when I was a student nurse, hanging out with other nationalities, which is possible. Of course, when you work in the Philippines, you're just going to be hanging out with our fellow Filipinos. And when you go outside the country, yes, you can hang out with other nationalities, but it also depends on your attitude. If you have a great deal of attitude that you can share with them, so if you can attract good people, different people, which is that would be great. So that's possible. And other reasons why you took up nursing, why we took up nursing. I haven't thought about this. Some people told me that they took up nursing and go abroad to invest in the Philippines. I'm not in a position to say that it's silly. I have my own life and they got theirs, sorry. So that, yeah, they were able to buy a big house in the Philippines while they're living somewhere else outside Philippines. And they were able to, some of them, I got colleagues here. They were able to build a couple of business in the Philippines while working here, and their family are the ones managing the business, which is also good. It all depends on how you manage your money and what you really want in life. I'm just here to tell you that that is possible. Lastly, well, to some retirees here, they actually save up money abroad to retire uh, rich in the Philippines, to retire as a financially free folks in the Philippines, which is possible. So speaking about the job satisfaction, the workload in the Philippines is actually, it could be a little bit different or lighter outside the Philippines. Some countries do maintain high standards when it comes to their manpower, so which is good. So lighter compared to Philippines, and the pay is good. Yes, check. Some countries they have really high pay, but the workload really is really a great deal of workload. They're gonna use you up, your energy, your body, because they pay you more, which is still justifiable. When you work in Philippines, the workload is sometimes too bad, sometimes it's manageable, but the pay is, I'm not sure if it's worth it. But if you have a good position in the Philippines, like you are nurse one, nurse two in a government hospital, or you are an official, you're a head nurse, you could have a better pay. Or you could marry someone in the Philippines with a stable job, so and stay in the Philippines, be happy and contented, which is also possible. And there's nothing wrong with that. I appreciate my fellow Filipinos staying in the Philippines, happy, satisfied. Kudos to you guys. And the only downside of being abroad is that you'll be away from your family. So that's just the downside. But if that's what your family wants you to do and that's what you want, you can just enjoy what you have while you're in abroad. And besides, you can make it up to your family, go home every year, every once in a while. You've got the money anyway. What about that? So overall, uh, nursing as a career, just like any other jobs, any other career, you got to love it. You can't be doing your job for the sake of money, unhappy, and be empathetic to the clients or patients or other people that you're facing while you're doing your job. You know, empathetic at the same time. You can't. What I'm trying to say is you can't be happy and empathetic at the same time. There must be only one emotion in the boat. Like so, you got to love what you do, and when you love your job, you don't really need to be somewhere else. You don't need anything else other than the freedom to do it. And you just keep working as a nurse until you get what you want. And what you want is actually personal. It could be, to see your family happy, to give them what you want, or to go to abroad while you're in the Philippines. Always remember that nursing is life. Other than the life that we have, we also have other life in other persona when we put our uniforms on. So as a nurse, that's also an inside job. You got to be happy. You can buckle up, get your act together, be the best as you can be to become a good nurse and make all your dreams come true as a nurse. Nothing is impossible. So once again, this is Anne of Reinforcement Club. You never lose. You either win or learn. Have a lovely day.